Okay, so now we're going to break down the room and disinfect our impressions. So the patient just left. So Professor Monk is going to first disinfect her impressions. So they're here in the tray. He's going to grab that tray and we have to rinse them. Get all that nice food and anything that's in the impression. So you want to rinse the impression and you want to hold it in a downward motion in the sink. If you hold it straight up, it's just going to splatter everywhere. So you kind of hold it down, make sure you rinse it good, shake it off, and then she's going to place it in the other side of her tray over here. There we go. Then we're going to do the lower. See how she's kind of holding it down and rinsing it really well. Everything off of there. Good, shake it off. Now that's the cleaning, so now we're going to disinfect our impressions. So we're coming back over. That's still gonna go to the dirty side because the tray is dirty. The impressions are dirty. She's gonna turn around and grab her bottle and she's gonna spray disinfectant over that impression over her tray. Okay, so you're gonna spray, spray, spray. Get it in there really well. Shake it off. And then we're gonna go to her baggie. So her baggie's open over here. She's gonna put it in upside down. Upside down, and then we're gonna spray the handle because that's where we were touching. So spray, spray, spray the handle. Come back, we're gonna do the next one. So we're gonna spray in a downward motion. So you want that disinfectant everywhere. Spray it really good, get it all in the teeth. Perfect. Then she's gonna shake it out of there. Gonna go upside down in her baggie. And we go upside down so that she can spray that handle really well where she was touching. So she's gonna spray that handle. Perfect. And then the bottle gets set back down and she can just pull that barrier right off the bottle because we're done with that. All right, now we're going to break down our room. So that disinfectant can do one of a couple things. We can soak it up with a paper towel, we can dump it in our alginate bowls, whatever needs to happen there. Now this bucket that we were using, this tray, has a barrier on it. So we are just gonna shimmy it out of that barrier and drop it onto the clean side. So you wanna pull it back where she's not touching it. She's gonna drop it on the clean side. Perfect. Now that's ready to go. Then she's gonna pick up her bowl and clean out any of the excess alginate right here in the operatory. Okay. Some alginate in that one. Gonna clean it out. Then that's in the spatula. We're gonna wipe the spatula off. Good. And then we'll put all that on the tray. Then over here on the patient tray table, we're gonna grab the patient goggles, the patient napkin, and the barrier. All that can go in the trash without touching underneath. Patient goggles go on the tray because those are gonna get processed in the contaminated area. We're gonna get off our barrier on the chair without touching anything. Perfect. Good. That's gonna go in the trash. And now we're going to head to the sterilization area. So she's gonna start to fold up her barrier. We're gonna get the barrier off of the PPE basket while we're here. Perfect. All right, so we're gonna roll everything up. So you see how she's kind of rolling it, getting it all together. There's gonna be a lot of alginate and everything everywhere. Usually a pretty messy process. As she gets close, she's gonna pick up her tray, fold up the barrier, drop it in the trash, and now we're gonna head to sterilization. We're gonna drop it on the contaminated side in the rack. She's gonna remove her gloves, hand hygiene. And then we have to go back and close up those baggies. Or you can even have a partner or someone, an instructor, close up the baggies. So hand hygiene. Head back to the room. And we're gonna seal up those baggies. And then we'll push our timer for 3 minutes. Perfect.